Extensive research on the overall psychological impact of COVID-19 on the globe will continue long after the pandemic has come to an end. But what about our kids? Exactly what kind of residual impact will there be for the youngest folks? And what is being done to help keep them in a strong, healthy mental outlook? KLBK's Paul Tubbs has more.
Keeping kids in motion in a healthy mental state is a challenge regardless of what's going on in the world, let alone during a pandemic.
They don't really care what's going on in the world around them unless you make it important to them. And so, they're really egocentric. They're really good at being present-minded.
If we can do these programs and it gets people moving and it gets people feeling like they can be in control of their mood and their attitude, that's an empowering trait.
While the South Plains area may not be experiencing massive lockdowns, this is definitely not the case for all parts of the state and for sure the country. Many students still stuck at home, which can wear on the mental health aspects of some of the most vulnerable and impressionable. This is why former 5-time women's boxing champ Mia St. John and her brother Duncan Richardson found it important to come up with a plan to get kids in a positive mindset with a new program through Bodies in Motion, Virtual Recess.
Kids are not going to school. They're cooped up in the house all day. They're without their friends, their peers. They don't have that social interaction. They don't have PE or recess, to get out there, all that energy that kids have.
And we thought, man, we can help people. This is what we do. How can we pivot and interact and get people moving and still empower them, even if everybody's having to learn virtually or they're in lockdown?
St. John and Richardson know firsthand the effects mental illness can have. St. John losing her son to suicide back in 2014 at the age of 24.
I dealt with the horrors of losing a child. And that's just something that me and my brother, we just want to prevent or bring more awareness to it.
And the statistics can be rather bleak. According to the National Center for Health Statistics, from 2000 to 2017, the suicide rate has been on the rise even in kids 10 to 14. The American Federation of Suicide Prevention confirms those numbers in the last few years, as well as suicide now is the second leading cause of death. This, according to St. John, Richardson, and Dr. Wakefield, creates the perfect opportunity to change this dynamic.
Kids pick up on all of this nervous energy. They want to model, or they just do model what the adults around them are doing. And so if everybody's like, yeah, I don't like this situation, but we're going to be okay, and we're going to stay connected, and we're not going to be fearful, then the kids typically say, oh, well, we're okay. We don't have to be fearful.
We have to just stay positive and know that change is always going to happen, and we've got to learn to evolve and grow.
Paul Tubbs, KLBK News.